Good morning, meet Tina here. Hi everyone, and you probably noticed that I always film this video inside my car, and this is because I usually like to do recording after I go for a walk in the morning. I have been doing this daily morning walk since I was discharged from the hospital on this. I think like starting the first week, I wasn't able to walk at all, even a few steps, but I sort of like forced myself to do little by little, to take like one small dragging step was very difficult for my lungs, especially after the first week, of discharge from the hospital. God, I still remember it. It's been like going on the 5th month now. I can't believe it's been 4th month already. And I can actually feel different, and this is why I decided to do all these videos, to share all the symptoms, that I have experienced. And I believe, because I have actually seen it on the internet, YouTube, and from the blogs and different websites, that all the COVID patients, post-COVID patients, long haulers, they all have the same, similar side effects, post-COVID symptoms. We all pretty much have the same thing. It also depends on the degree of the damages that's being done to your lungs, your heart, nervous system, and everything. Depends on how bad you have your pneumonia. In my case, again, it was very severe. I almost was intubated on the 3rd or 4th day of my stay in the hospital. But I think it had to do with my determination. I stay on prone position for at least 20 hours a day. I mean, since the first night, because I fought for my life. And also, I believe it's a two treatment of convalescent plasma, plus all antibiotics, different type of antibiotics. I think it's 4 or 5 types, and 2 different types of steroids that they used on me. So it kind of messed up my body and caused all these side effects, symptom. And the one I'm going to be talking about today is the pain or the soreness on my muscles or my soft tissue. During the first week, I noticed that. I mean, I feel soreness all over my body. The treatment itself with antibiotics, convalescents, plasma, and steroids has been a painful process. I don't know which one caused pain, but on my last video, I did mention that I felt so much. I mean, I felt everything running through my body. It's like a chemical through my body. It was a burning sensation. It was painful sensation, and I can just feel on the right side of my body running through half side of my body and my whole body for hours. And it's been going on for like a couple weeks. And I had such a bad migraine or splitting headache that I had to take Tylenol every day. And I never did in my life. It's like once in a blue moon. I'm not the one that ever get headache like some people did. So what happened is the muscles of soft tissue soreness or pain, it happened to all the COVID patients who have gone through this treatment. And it was very painful. And for me to touch myself just a little bit on here, I remember clearly that I just felt like perhaps it's like a tendons or blood vessel. I'm not sure which one, but it got really hard, which is very unusual. I even asked the infectious doctor, like, what is this? Why is it like this? Why it got so hard? Like a big vein that just pops out, and it's very hard feeling texture. And that's, to me, it's very unusual, and it's painful. It's like sore. And like bruised. It felt like bruised, actually. That's a good way to describe it. So the infectious doctor said it shouldn't be this way, trying to like massage it out. So, I was like, oh my God, every time I touch it, it's kind of painful, and sore, bruised, feeling like. So, and then I remember I would have, my God, my body just felt sore all the time. And I felt weak. And one thing I noticed, because I used to work out and lift weights and, did CrossFit, I used to have a lot of muscles. But after 2 weeks of, being in the hospital, all my quads were gone. all the muscles in my arms and everything's gone, disappear. You know, my butt that I work hard for, deadlift over 200 pounds, gone. I gained so much weight, but anyway, it doesn't really matter right now, because what's important is my health at this moment. However, speak of the pain on the muscles, it is real. It's very painful for a good 2 months, and I believe that it caused the depletion of the muscle mass, because I did notice my body, actually all my muscle mass just disappeared. It's gone. All those years that I work out for, you know, liftings and, you know, training hard, it just wash down the drain. And it's all right. And I felt really weak, but I don't really know exactly what caused this, but you know, this symptom does exist. And I actually feel better now. Right now is the end of the 4th month of my recovery process. I don't feel pain anymore, but I think it's starting on the 4th month. The 3rd month I still felt it, because it did come and go. And when it come back during the 3rd month, I got really scared. I was like, oh my God, it's still here. But then it's starting to disappear, and I don't know if that has to do with my daily walks that kind of help. You know, and I've been taking a lot of supplements for immunity, and which I'm going to be talking about on the next video. And you know, you can try it out if you want to. But anyway, this is one of the symptoms I like to share, is the pain and the soreness of the muscles and the soft tissues all over your body. And I remember one time, it's like the whole back of my neck, oh my God, even runs like sharp pain, like nerve pain running down. It was very, very painful for a while. So these are the symptoms that actually occur to me, but I'm sure that occurred to a lot of people too. There's been a lot of reports about that, and it did go away. I don't really feel it much anymore. I mean, very mild. And I don't feel that when I press, you know, when I press on my skin before, my forearm, it was just like bruised. It's just painful. Now I don't feel it. So, you know, just wanted to share with the audience and everyone who listen and have this symptom. Do not be afraid. Do not be scared, because I think this is going to go. You know, your body's going to pass through it in time. But also do take some sort of supplements that kind of boost your immune system. So I'm going to be listing that and talk about that on the next video. All right. So with that said, thank you for listening. And if you feel like this video is going to be beneficial to anyone that you know that may have this experience, please do pass it along and share my video, because it can be useful to them, or it can be even like comfort to them to know that, hey, you know, I'm not the only one. Because I remember when I have all these symptoms, I was like, what's going on with me? I wanted to find out what's going on, if somebody else have it too, and what did they do, and would it go away, and what would I do to heal myself? Because like I said in the prior videos, that all the doctors, they're not even sure what treatment to use for their patient right now with the COVID to heal themselves, because this is new to everyone, new to all the doctors, you know, all the scientists. All right, so we are actually learning together at the same time and kind of help each other, doctors, scientists, and patients, you know, people who survive through this, and be able to share about it. And so this is going to be a journey of healing and recovery for a lot of people in this world. And just stay positive. You know, that's one thing we can do, and just keep pushing it. And definitely you need to walk. Don't push yourself. Just go in the morning, because of fresh oxygen in the morning is one of the best. And I feel like my lungs open up more and more every day as I walk. The more I walk, the more my oxygen saturation got better. Okay, and now I noticed this week I haven't even looked at my pulse oximeter as much as I have done in the past 4 months. So I'm quite happy about that, because, you know, this is telling me that I'm feeling much better. All right, don't forget to subscribe, click like, or click the bell, you know, if you want to be notified about, you know, all these experiences I'm going to do. I'm also planning to start going to the gym, starting to do weightlifting. I'm going to start losing weight because I gained probably about 30-40 pounds from all the medications and perhaps the emotional trauma, because I think I'm an emotional eater. And I probably gained like 40 pounds. My face is all puffed up now. But anyway, it doesn't matter. And perhaps you would like to join this weight loss challenge with me, and we'll do it together. Until then, see you. Thank you so much.